Hi, I'm Dr. Jonathan Zelken. I'm a board-certified plastic surgeon in Newport Beach, California, here to talk about Coolsculpting and something called PAH. PAH is a rare, and it's very unusual, but it's something that's a non-zero complication of Coolsculpting. What is Coolsculpting? Coolsculpting is also known as Cryolipolysis, and essentially you get an applicator like this, and you put it over an area of fat that you don't like, and it sucks the fat in, and it actually freezes the tissue, and adipose cells or fat cells are very sensitive to this freezing and essentially will disappear. They'll get damaged and your body will metabolize them. And when your body metabolizes these cell fragments through your liver, it goes away. So you're truly losing fat without surgery. A lot of patients have very positive experiences with this, and it's the most popular non-surgical fat reduction therapy in the world. And it's something that's really cool, very popular. I'm sure everybody watching this video has either had it or heard of it. But what happens when it doesn't go as planned? There are very few cases reported in the literature, I'm talking less than 50 in the literature, of something called paradoxical adipose hyperplasia in some studies and paradoxical adipose hypertrophy in others. Either way, we call it PAH. We don't really know if the fat cells are multiplying or they're just getting bigger, but either way, the whole fat mass is getting bigger, and sometimes you can even see it through your skin. It can be this well-demarcated, firm, hard, almost nodularity that's even more evident in thin patients and patients who gain weight after the procedure. Why does this happen? If you're trying to go to a provider to lose fat, why is it getting bigger when it should be getting smaller? There's a lot of theories on this, even though it's a very, very rarely described phenomenon. What we do know is that this cryolipolysis is doing something effective for the superficial fat layer. What does that mean? When you look at your abdomen, for example, you have your skin, you have a fascia, which is like a leather-like membrane that holds the fat cells together, and you have your abdominal wall or the muscle or the six-pack. You have a superficial fat compartment, and you have a deep fat compartment. When you do cryolipolysis, you're targeting that superficial fat compartment, and it gets smaller when it works. When it gets smaller, most of the time it looks good. You have fat reduction, you're happy. But in very, very increasing numbers, we're seeing something called PAH when you have a compensatory increase in that deep layer. It kind of bulges through, and it looks like you've got like a block of cheese or a brick of cheese or something like that under your skin. And it feels like that too, and it can be tender. Here's what you need to know. The incidence, meaning how often this occurs, is really, really underreported in my opinion. We hear that it's so rare that you may never see it. However, 2 or 3 times a week I'm seeing patients in my practice who either knowingly or unknowingly have it. It's real. You're not alone. If you do have it and it doesn't bother you, great. That's it. You've had a successful treatment, or you don't see much of a change, or you don't really realize that this is happening. But if it does bother you, here's what you need to know. Number 1, don't go back and get more Coolsculpting. I think a lot of Coolsculpting providers are going to suggest that you do that, but you may be exacerbating this problem. Number 2, wait 6 to 9 months before you do something about it, because a lot of times this natural inflammation is going to resolve on its own and you'll look great. Number 3, if you do have it, you should see a board-certified plastic surgeon after 6 to 9 months for definitive correction. Because there's a tissue expander-like quality, meaning that it's expanding the skin, you've got to do something about the excess skin that results, as well as the excess fat. In my practice, what seems to be most effective is going to be a combination of liposuction and skin tightening. For this, I use something called Body Tight and power-assisted liposuction. The power-assisted liposuction is essentially like an oscillating saw, and it has an exploded cannula that has like kind of a fat disrupting tip. It's a little bit blown out, and it allows me to kind of penetrate this firm, thick fat that wouldn't normally be sucked out easily. I also apply energy in the form of radio frequency energy, which your body sees as heat, to try and cause deep inflammation and collagen production to tighten these stretched ligaments that can occur as a result of PAH. The patients who I've treated are all over the map in terms of age, BMI, ethnicity, and how many treatments and when their treatments occurred. It doesn't seem, in my experience, to favor a certain ethnicity, gender, or age group. The results I've seen have occurred in almost every single case after one treatment of this, and it could be awake or asleep, but you really need to see a board-certified plastic surgeon to discuss this further. I hope this helps, and most importantly know that A, this is very likely treatable, and B, you are not alone. Thank you so much for taking the time to watch this video.